Being told you need brain surgery is frightening, but a craniotomy is one of the most common brain operations. A craniotomy means temporarily removing a small piece of skull bone so the surgeon can safely reach the brain underneath. Neurosurgeons perform craniotomies for many reasons: brain tumors, aneurysms, bleeding inside the skull, severe head injuries, and some forms of epilepsy. Not every brain problem needs open surgery. Some aneurysms are treated through blood vessels, and some tumors with focused radiation. Before surgery, expect detailed brain imaging, blood tests, and a review with the anesthetist. Blood thinners are usually paused in advance. In the operating room, general anesthesia is given. The head is fixed still, and image guidance tracks every instrument like a GPS. The surgeon lifts a small bone flap, opens the protective membrane, and performs the work, removing a tumor, clipping an aneurysm, or clearing a clot. At the end, the bone flap is fixed back in place with small titanium plates and screws, and the scalp is closed in layers. Patients wake in intensive care for close monitoring. Most move to a regular ward within a day or two and go home within a week. Recovery happens in phases. Fatigue is the most common symptom. The brain uses enormous energy to heal. Most people feel better by 6 weeks. Doctors also discuss risks: bleeding, infection, seizures, or new neurological changes. The specific risks depend on your diagnosis and location. Rehabilitation may include physiotherapy, speech therapy, or neuropsychology. Follow-up imaging continues, and driving resumes only when the team clears you. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.